Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hi everyone, this is Johnson Duncan. You may recognize my voice from the episode discussing our trip to the Philippines, but today I'm coming at you in a more professional capacity. Today we're going to talk about blood pressures. Who am I? So I am a family and emergency certified nurse practitioner. My background includes being a cardiovascular intensive care nurse, as well as working in emergency medical services as an EMT for about 8 years. So what is blood pressure? You have a top number and a bottom number, but what does that even mean? What is that? So the top number, the systolic number, is the bigger one. And what that number represents is the pressure pushing against the walls of the arteries when the heart beats. And that number is on top of a smaller number called the diastolic number. And what that diastolic number represents is the pressure against the walls of the arteries in between the heart's beats. So now that we know what this number actually represents, we can dive a little bit deeper. The punchline is that we want to see blood pressures that are under 120/80. I know everybody here got education on this when they were in hygiene school. Well, we'll go back through it and do a little refresher. So how should we take a blood pressure reading in the op? In the perfect scenario, our patients show up, whether it's to the dental office or their primary care appointment or the urgent care, the ER, whatever office it is. And ideally, they haven't been drinking caffeine all morning. They got a good night of rest. They don't smoke cigarettes. And they're not freaked out to be in any sort of healthcare professional's office. But the reality is, many of us don't sleep enough. I know, speaking for myself, I require multiple cups of coffee in the morning to get going. And many folks do smoke cigarettes. So what can we do to combat these different things that will affect our blood pressure readings? We can provide a calming environment in the op. And if that means needing to dim the lights, we dim the lights a little bit. And if that means needing to wait just a couple of minutes while an administrative task is done while the patient can settle in, then we should do so. Allowing this extra time for the patient to relax and get comfortable within their environment can do wonders to find a lower and more accurate blood pressure reading. The AMA and the AHA recommend resting for 5 minutes in a comfortable position before starting the measurement and then taking 2 to 3 measurements 1 minute apart from each other. They also recommend avoiding having distractions in the environment. So if you have a TV on, maybe having it off during that period. These are the things we can do to find a more accurate blood pressure reading. Frequently, in my workspace, I'll find that an initial blood pressure on a patient is significantly elevated. And if I give them about 5 to 10 minutes to relax and then talk to them and take another blood pressure, typically it's significantly lower. And it changes the course of treatment for the day. So why are we taking these blood pressure readings in the op? Many folks will say, well, that's something for the medical staff, for the NPs and the PAs and the docs to do, and they can figure out what's wrong with someone's blood pressure. And I understand that everybody in all forms of healthcare are swamped. Everyone's running as fast as they can to complete all their tasks with each patient effectively, get their documentation in, and get on to the next one. But there are some features that are really relevant when it comes to taking these blood pressures. So many folks might not see primary care. What does that mean? Well, if they don't see primary care, then there's really not somebody who's measuring their blood pressure even once a year. And if you don't get sick otherwise, or you're not someone who goes to the doctor's office, your vital signs probably aren't being taken at all. So you might not know that you're living with high blood pressure. Again, why is this relevant? Why is this important? Well, if that person gets a cleaning a year, or ideally 2 cleanings a year, that might be their only interface with anyone in healthcare. So let's talk about why that matters. Let's talk about the big concerns here. The reality is living with high blood pressure, or as we call it, uncontrolled hypertension, can very easily lead to life-changing events like stroke, heart attack. Over time, people can develop vision loss, heart failure, kidney disease and kidney failure, as well as sexual dysfunction. On more than one occasion, I've seen a patient in the ER with high blood pressure and ask them, hey, did you take your medicine today? And the patient says, no, I stopped taking it because I think I don't need it anymore. I've been feeling fine. And we come to find out that that patient is actively having a stroke because they weren't controlling their blood pressure. For the purpose of this TIPisode, it is beyond my scope to tell dentists and hygienists who they should treat based on their blood pressures. However, there are a few findings that are very, very relevant in the setting of having an elevated blood pressure when you see your patient. This brings us into hypertensive crisis. So what is a hypertensive crisis? Well, there's two forms. There's hypertensive urgency and hypertensive emergency. Both are significant. The big difference is that one has symptoms and the other does not. In these hypertensive crises, we typically see blood pressures that are greater than 180/120. Hypertensive urgency will be the patient who has no complaints, feels completely fine, but has a blood pressure greater than 180/120. But hypertensive emergency will include a patient with the same blood pressure, but that patient might also have chest pain, vision changes or trouble seeing, a bad headache today, numbness or tingling, even back pain. They may have shortness of breath. This is the patient that immediately needs to go to the ER to be evaluated. We've talked about what the blood pressure reading means and the significance of the numbers. We've talked about the best environment to take that blood pressure in. We've talked about the big concerns that uncontrolled hypertension can lead to. And we've talked about the hypertensive crises and what to really look out for when we're taking a patient's blood pressure. Lastly, let's talk about what we can suggest or even do in our own lives to help lower our blood pressure. We can eat a balanced diet and try to keep it lower in salt. We can limit our alcohol consumption and try to quit smoking. We can work to maintain a healthy weight. We can enjoy regular physical activity. The recommendations are 2.5 hours of moderate intensity activity per week or 75 minutes of vigorous activity per week. We don't need to do all that activity in one sitting. The goal is to find something that makes us break a sweat that we can do a couple of times a week, and we can work up to those goals. And finally, we can encourage our patients to work with our primary care provider or review any recommendations and insightful ideas on the American Heart Association or American Stroke Association websites. Thank y'all so much for joining me for today's TIPisode. If you'd like to reach out with any questions or comments, you can email me at johnsonduncan@gmail.com. Have a great day, everyone.
A tale of two hygienists.